You're listening to Regional Health Update. I am your host, Michael Moon, and February, National Heart Month. Joining us today to discuss heart health and its history, cardiologist Dr. David Lee. Good morning, doctor.
Good morning.
Dr. Lee, tell us a little bit about your background.
I am an interventional cardiologist practicing at Montrose Regional Health. I grew up in Chicago, did my undergraduate degree in engineering, then went to medical school at Northwestern University, did my internal medicine residency at Stanford, and my cardiology fellowship at the Cleveland Clinic. I've been in Montrose practicing here for approximately almost 8 years now.
Dr. Lee, let's just dive right into this. Heart disease actually runs in my family, and I've experienced heart issues as early as 36 years old. And I was actually in the best shape of my life. I was having some chest pains, and I found out that my coronary artery was blocked 90%. And my cardiologist, after he put the stent in, had told me that genetics was up against me. I actually suffer from small arteries. That's genetics. So it is true that family history does play a role in heart health, correct?
Absolutely. I think that we consider family history to be a risk factor for an individual person if they've had, especially if they've had a premature heart disease in their family, like if they've had a first-degree family member who's had heart disease, men under the age of 55, women under the age of 65, and that's certainly something that comes into our overall global assessment of someone to sort of determine what their heart risk is.
Everybody hears about cholesterol, but how does it affect your heart?
So cholesterol is a very specific, lipid of which, we have a number of lipids in our body, and the reality is that lipids are an essential component of our cell membranes, and whether that is cholesterol or other lipids, and as such, what has happened is that our bodies have evolved and developed means to basically be able to make sure that we have adequate supplies of cholesterol that can be utilized by our cells and our cell membranes as we need them. I think the issue is that sometimes we have so much lipids and cholesterol that are in our circulation, more so than what we need, that can then influence essentially this interaction with our artery walls, some deposition, the formation of atherosclerosis. It's all tied together with lipids, but I think that it's a somewhat complex process that basically over time develops these plaques.
Gotcha. So what are symptoms of a heart attack?
I think that symptoms of a heart attack, most commonly, it is some type of chest discomfort. I think that the problem that we have with trying to describe, heart attacks is that our hearts are innervated by what we call more of a visceral nerves. They're not really the same type of nerves in like our skin. Like so, for example, our skin sends and our nerves in our, let's say, our hands. We can detect anything that's sort of sharp or so pressure. Unfortunately, in terms of for your heart, it can be very much more vague. And that's some of the concern and questions that we always have, because you could feel a squeezing sensation or tightness or pressure, a crushing sensation in your chest, something like there's a band or there's a weight on your chest. But other times, I think that people may present with other symptoms as well. It feels more like heartburn. No, it's more breathing issues. Oh, gosh, I feel really sweaty. I feel uncomfortable. There's something wrong. And I think that that's one of the challenges that we have is that the symptoms can be hard to sort of describe or define. And I think for each individual, how they present with those symptoms can be a little bit different.
You mentioned breathing. A lot of people don't understand that your lack of oxygen when you're walking could be a symptom, as you said, correct?
Yes. And some people, especially people who are diabetic or other people who have other issues or conditions, can present more with just saying, gosh, I'm just having more trouble catching my breath. Or sometimes it's hard to differentiate. It's like, you've been exercising for a while, you're breathing hard, it hurts a little bit, and you're trying to decide, gosh, is that my breathing? Is that my heart? Is that my chest? What is that?
What should folks do if they think they're experiencing a heart attack?
I think that anyone who thinks that they may be having a heart attack should call 911, the EMS. You want to get immediate attention and evaluation and safe transport.
All right.
We don't recommend that either A, you drive yourself in, or that you have a loved one drive yourself in. I think the concern is that, when people have heart attacks, acutely the thing that is most likely to kill someone with a heart attack is a bad heart rhythm that makes you unconscious. And so obviously driving yourself in where you're at risk for that would be a bad idea. And I would also tell you, don't do that to your loved one by having a situation of where you might have an arrest in the passenger seat as they're trying to drive you in. So that's why we always recommend, calling 911 or EMS.
So what treatment options may those folks receive at Montrose Regional Health if any issue is with the heart?
So our program in cardiology here is now close to probably 2 decades old. I think that one of the things that you always have to, determine, for us in our population and our demographic and our geographic location is, what can we do? What services do we need to focus on? And one of the priorities that has been there and has been existent for the last 15 plus years has been the acute treatment of heart attacks. And so if someone comes in with a heart attack, we wanted to make sure that they did not have to get shipped several hours away to try to get treatment done. And so we have basically the facility, the staff, the physicians, everything to be able to take care of your acute heart attack essentially immediately, at Montrose without having to go anywhere else. And so for people who are having heart attacks, most commonly what would happen is that if you're having a very large heart attack, you would go from the ED to the cath lab. You would get a heart catheterization and coronary angiography, an invasive procedure. We determine exactly where the blockage and occlusion is and treat that right then and there, typically with balloon angioplasty and stent placement.
Big thank you to Dr. David Lee, cardiologist at Montrose Regional Health. Information presented in this podcast is for informational, educational purposes only and is not meant to diagnose any condition or provide treatment advice. Please work with your healthcare providers to determine appropriate treatment for you. You've been listening to Regional Health Update. I'm your host, Michael Moon. Thank you so much for listening. We'll talk to you again real soon.